you, Jeff. It is 6:42, and it is Tuesday. That means it's time for our Live on 8 segment with Teton Medicare. And joining us this morning is co-founder Casey Peterson. Thanks for getting up early with us. We always appreciate it. And so I want to start with this. 65, that's the traditional age for a lot of people for retirement. There's quite a few people that work beyond that age of 65. So if you're past 65 and still working, what do I need to know regarding Medicare?
Great question, Dylan. So the first thing I tell you is to call us. So many people, try to make the decision by themselves, try to take the time to figure it out, hear something on TV, see their neighbor's, best friend's, barber's, dog groomer tell them this is what I should do, and then later regret that decision or have given up hours and hours to make that decision. So the first advice I have people is call us. We will walk you through it. And if you're going to continue to work, a lot of times there's things you don't need to do. And so you might be overpaying for something you don't need to be doing if you're going to continue to work and stay covered by your employer's plan. So give us a call. That's the first piece of advice.
All right, and tell us about the Medicare Advantage plan. What's that about?
Super popular plans, and they become more and more popular over the years. And the reason for that is that people will find that those plans cover them for doctors, hospitals, prescriptions, dental, vision, hearing, a gym membership. A lot of the things that people want their coverage to look like. They want to have coverage for dental. They want to have coverage for eyeglasses and hearing aids. And Medicare Advantage plans can do that. They're going to cover all the things that Medicare requires. So your doctor's visits, your specialist, your colonoscopy, all of those really important preventive exams are going to be covered by Medicare, are going to be covered by Medicare Advantage plan, but they're going to wrap up all of that coverage for hospitals and doctors and prescriptions and dental in one plan.
Well, that sounds like a great thing to look into. Now, I'm kind of curious too about, we talk about that 65 age again. If you plan on working past 65, when is a good time to reach out to you guys?
Great question. I tell people about 6 months. So if they're going to continue to work past 65 and they're 64, 64 and a half, give us a call. Let's walk through an option, because if you're with a large group employer, maybe you have more than 20 or 50 employees and they're all on the health insurance, you really don't have to do anything if you're going to continue to work and keep covered by their employer health plan. If you're on a small company or you're self-employed or have a company that doesn't offer insurance, then there's things you have to do or you're going to be penalized. So give us a call 6 months. You can call us anytime. I mean, if you're 55 and have questions, we're happy to take those calls. If you're 80, but if you're turning 65, or going on Medicare within 6 months, give us a call.
Make sure you hit the ground running when you
We'll get you. We'll get you. We'll make sure you're happy.
All right. Thank you so much for joining us this morning, and we look forward to having you next week.
Appreciate it. Thanks,
All right, thank you so much. We'll be right back.